Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In this video, we're going to be talking about a medication known as Fosinopril, or Monopril. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. In this video, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe Fosinopril to a patient, followed by contraindications or reasons we would not be able to prescribe this medication. We'll then discuss examples of dosing and then follow it up with side effects with percentages. I put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss would be the mechanism of action, or how this medication works. So Fosinopril sodium inhibits angiotensin converting enzyme, or ACE. It is believed to lower blood pressure by suppression of the renin-angiotensin-aldosterone system. Inhibition of ACE blocks the conversion of angiotensin 1 to angiotensin 2. This causes a decreased vasopressor activity and decreased aldosterone secretion. In terms of indications or reasons we would prescribe this medication to a patient, you may see it used in hypertension or high blood pressure, as well as an add-on therapy in heart failure. With respect to contraindications or reasons we would not be able to prescribe Fosinopril, the only real contraindication here is if a patient had a hypersensitivity to Fosinopril, any other component of the formulation, or other ACE inhibitors. Now, for examples of dosing, so in hypertension or high blood pressure, the initial dose would be 10 milligrams orally once daily. For a maintenance dose, we would see 20 to 40 milligrams once daily, or in 2 divided doses. The maximum dose would be 80 milligrams, as it may be used in some patients. For heart failure, the initial dose would be 5 to 10 milligrams orally once daily. The 5 milligram starting dose is recommended in patients at an increased risk of experiencing a hypotensive response, or a response leading to low blood pressure. So an example of these patients would be patients who are volume depleted, or patients who have moderate to severe renal failure. For a maintenance dose, we would have 20 to 40 milligrams, and the maximum dose in heart failure would be 40 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Fosinopril, so we'll go over some of those here now. Hyperkalemia or high potassium levels may happen 2.6% of the time. Dizziness may occur 1.5 to 12% of the time, and a cough may occur in 2 to 10% of patients. Nausea and vomiting may occur at a rate of 1 to 2%, and hypotension or low blood pressure may happen 2.5 to 4.5% of the time. One serious side effect would be intestinal angioedema. Alright, that's all we're going to talk about today with Fosinopril or Monopril. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.